Okay. Um, so a pregnant lady with PCOS, we all know that physical activity is very essential, uh, not just for general maintenance of body, but for preventing complications like PIH or for gestational diabetes, to prevent excessive weight gain, for any kind of pregnancy complication, to ensure that the pregnancy goes on smooth, and for better birth outcomes and pregnancy outcomes. And earlier, 20 years back, there were a lot of reservations about exercises. Women would say that, no, I will just do my household work. That is sufficient exercise for me. But now the concepts have changed a lot. Now people will ask, can I still go to the gym? So can I still do my weight training? So when we say that yes, you can be active as possible, then people will say, then I will start going and playing badminton. So these are all, things we need to consider. So let us consider what WHO is recommending for pregnant ladies. So WHO has clearly suggested that for in all comfortable pregnancies, the low risk categories, at least 150 minutes of moderate intensity aerobic physical activity should happen throughout the week. And there should be some kind of strength training activity which should be happening in pregnancy, and sedentary time should be restricted. Now there are with more and more women who are into the corporate world, who are in the IT industry. There is a lot of sedentary work happening. So they are working just 10 hours in a day, so all the time is spent in the sitting position. So if they can introduce some kind of fitness activity in between their work also, then that is a healthy practice. That is what is the WHO recommendation. Though this is the recommendation, WHO is also clearly saying that 60 minutes of exercise daily is a requirement for all low risk category women who are in the pregnant state. So at least 5 days in a week. So it is highly recommended that women should be encouraged to exercise on an average. We should say 7 days in a week, only then they will land up exercising at least 5 days in a week. 60 minutes of exercise is recommended. So when we say moderate intensity exercise, it can be brisk walking, it can be light weights, and it can be yoga, and it can be swimming. These are all safe activities which can be easily recommended for pregnant ladies. And most of the PCOS women who are used, many a times they may be in the higher BMI category. So sometimes it is safe for them to do light intensity exercise for a longer period of time as compared to doing moderate intensity. We don't want them to be jogging, because there are several ladies who may say, I used to jog regularly. That is how I lost my weight. So, and I have seen that, it is okay. There are several people who have put up their videos on YouTube or on the, social media, that can I jog. So these are all not the things which we would recommend in pregnancy. Rather, walking is a better form, not running. So mild intensity as compared to moderate intensity. And if we can keep it like 60 minutes, that is a achievable goal for most of the pregnant ladies for getting better health benefits. So when it comes to the first trimester, if a person is already into a lot of exercise before getting pregnant, she is at a definitely a better advantage, because her exercise endurance is very good. But at the same time, we need to control her urge, because she is very enthusiastic. She wants to not stop the gym. She wants to continue weight training. She wants to do a lot of exercises. So depending on her health condition, depending on if all the parameters are good, as a doctor you would either allow some exercise or more of exercise. If there is no spotting, bleeding, or no any threat, no threat for any miscarriages or abortions, then we can very well allow them to do mild to moderate intensity exercises. So initial, the safe bets which can be done are definitely walking. Investing on a good sports shoes is a must, because it will reduce the ground impact on the joints which are already getting slack. And it is always better to be walking out, in the open area, breathing the fresh air. If that is not possible, even in a treadmill should be absolutely fine, but walking shoes are a must. Otherwise it will have a great impact on the slack joints, and it can give rise to pelvic joint dysfunctions, knee pains, and things like that. And first trimester is also a good time when we can address the pre-existing musculoskeletal dysfunctions. There are some ladies who may already be having any slip disc, or there is a pelvic joint dysfunction, or there is a torn ligament or an unstable ankle. So these are all things which needs to be properly exercised. We can build the strength so that it makes the foundation for their further fitness throughout their pregnancy. Good posture is definitely a very plus point. It can have a positive self image, especially when they are going to change their shape dramatically in the coming months. So we want to have a positive self image for the women. So checking on the posture, working on their core muscles. When we think of core muscles, we usually think it is going to be planks or pilates or something like that, which are much more strenuous, which we see on YouTubes or social medias. But core muscle activation can be as simple as breathing exercise. A proper breathing exercise where we focus on exhalation can activate the deep abdominal muscle, which is the transversus abdominis, which forms the foundation of core. That, along with Kegel exercise, can be a very good foundation. And we many a times we assume that simple exercises will not be effective. So especially those who have done a lot of weight training so that they have to lose weight, so they find it hard to believe that simple exercises can be effective. So it is a time to emphasize that simple, safe and sufficient exercise. We are not looking at weight loss here. We need sufficient exercise which will keep them fit for the rest of the pregnancy. So pranayams or simple stretches or soft exercises along with walking is just sufficient to follow in the first trimester, so that when the hormones are getting high and their body is not very much supportive, maybe they may be having some physiological anemia, they are not eating so well, they may feel fatigued. So this is something which will help them to get into a routine of exercise which is safe for them to do. And in case there are women who have the tendency to have a spontaneous miscarriages, then when they are exercising more, they tend to assume that it is because of the exercise they did that something went wrong. So this can have a negative impact on their subsequent need for exercise. They may think that exercise is not good for them. They carry a big baggage because the entire family starts blaming them, saying that because you did exercise something happened. So it is better to keep them on a low key, but keep them in the mode of exercising. When it comes to second trimester, this is the beautiful phase. This is the honeymoon of pregnancy. This is the time they can do everything. So now that the pregnancy is nicely stabilized, the possibilities of miscarriages are less, and then they are able to eat better. This is the time, along with their walking, along with their Kegel exercise, the core stability exercise, they should engage in good strength building exercises. So they can take up yoga forms, or it can be small weights. 1 to 1.5 kilos of dumbbells can be used. They can use um, bands, the exercise bands. So these are all good ways to ensure that women can keep their muscles fit and strong. And this is the time they should build up on their muscle reserve, so which will help in reducing their insulin resistance. So the possibility of, and it has a very protective effect from gestational diabetes and from pregnancy induced hypertension. So building up the muscle should be given a lot of importance. So in pregnancy, little can be more. So, and for a heavier lady with PCOS, their body weight also acts as a resistance. So, if they continue to do the same amount of exercise, it is like doing with more resistance. It is like increasing the resistance, because if they are doing a simple leg raise also, maybe 1 month later, if they have grown 1 kilo or 2 kilos heavier, so the resistance with the same leg is going to become more. So, it is doing with progressive resistance only. So, this kind of, and especially when we are doing the exercise bands, pregnant women are always requested to use low resistance bands, because when they increase the resistance level of the band, this can cause increased recruitment of the abdominal muscles. So there can be breath holding with that, so which may not be a safe thing. So low resistant bands are good, and they need to learn proper ergonomics to do the exercise, so that they can recruit the core muscles when they are doing exercises. If they are able to comfortably do the exercise, it is also recommended that if there is a safe pool which is kept clean most of the time, then swimming can be a good option for, maintaining fitness. There are dance classes which are conducted specifically for pregnant ladies. So, whatever kind of dance can also be a beautiful form of fitness for especially those ladies who feel that it's too boring to keep doing the same set of exercises. So, but whatever exercises they do, they have to listen to their body. We don't want them to exercise to the point of exhaustion. Exercise in a well ventilated room, have enough water, drink enough water to keep themselves hydrated, and not do over strenuous exercises. So this is what they need to follow in the second trimester, to focus on building strength, at the same time continuing with walking and other core stability exercises. And come third trimester, the abdominal muscles are getting overstretched. There can be more discomforts. If there can be GDM, so it is very essential not to stop any exercises at this point of time, because most ladies think that seventh month, oh, this is the point where we have to be very careful. My grandmother said that, seventh month you have to be very careful, eighth month is fine, but seventh month you have to be careful. They stop all the exercise. Whatever exercises they were doing, they stop, slowly taper off everything, and they are just doing only breathing exercise. So it is very important to emphasize the need to exercise, because this is the time the abdominal muscles are stretching. We don't want to overstretch muscle, because later on, for birth also, then the abdominal muscles don't have the kind of power to cooperate in the second stage of labor. And the postnatal recovery is better in women who are exercising in the third trimester of pregnancy. So, and here again, we have to take into consideration the diastasis which can be happening, especially women who already have a huge belly. They may have a larger diastasis also because of the extra fat they are carrying in the belly. So we need to check the diastasis and accordingly give exercises. So at this point, planks and all may not be a suitable option for, a huge PCOS client, and especially in the third trimester, because there is a risk of widening the diastasis. Because of late, many women are in the habit of looking at celebrity videos and following those exercises. So, they may ignore advices and they do things which they feel that, the celebrities are doing. But we need to understand that they are doing it with proper, support, and, with proper guidance. So it is very, very essential that every lady, when they start the exercises, get proper guidance as to what is safe for her body type and for her musculoskeletal system, which she can continue throughout. And here the focus can be on some flexibility also. So yoga poses are good. So Iyengar yoga is a good option, where there are a lot of props, there are belts. So any form of yoga can be used that way. But when there is a small word of caution when we are using yoga, because in yoga there is a lot of focus on flexibility. And many women have the concept that I have to focus more on flexibility because I need to get more flexible for birth. But just flexibility alone is not sufficient, because it will cause a over flexible joint. There can be pelvic joint dysfunction, symphysis pubic dysfunction, and so on. So stability should be given a lot of emphasis. So stability, in whatever poses they are taking, the stability has to be emphasized a lot, along with flexibility exercises. So this can be, continued in the third trimester, along with good strength, maintaining good strength, modification in the exercises, so that they can maintain the strength of the abdominal exercises as well as the pelvic floor exercises. Here, breathing
Thank you.
relaxation, so that they are not able to, they will not, get too anxious about birth. So that area can be
Okay,
emphasized.
Nagmaja, post delivery, we will take you in the panel for your the post delivery exercises. This has been a fantastic talk. Thank you so much for that. And you brought a very important point that even a PCOS patient, when she becomes pregnant, she needs to continue exercise, because ultimately it is the muscle exercise and muscle things which will bring the insulin resistance again under control. So it will help her to control sugars if they are becoming normal.